We are live. Uh, Good almost afternoon, and welcome to the Insurance and
Mine is
Pharmaceutical.
not working, yours is.
Um, Jim, you want to put yourself on mute, please? Thank you. This is the Insurance and Pharmaceuticals Subcommittee of the House and Government Operations Committee. We are near the end of our legislative session for this year. And as I was just saying to my committee, this is the time when the schedule is most erratic and unpredictable. So if you have a bill that you know is going to be in the subcommittee, please watch and listen for updates on scheduled meetings, etc. So today we had five bills on the agenda. We are going to hold House Bill 376, and we will be talking about that in our meeting next Tuesday. So please, if you are here only for Senate Bill 376, then you might go have some free time. So with that, I am going to start with Senate Bill 357, Prescription Drug Affordability Board, Authority and Stakeholder Council membership, lowering prescription drug costs for all Marylanders. This is Senator Guy's cross-file of House Bill 424. There are some amendments. Lisa, want to tell us what the amendments do?
Sure. I was first just going to briefly say,
Oh.
tell the subcommittee just that the Senate made some amendments that we did not add to our original bill. So they're already in there. They're not amendments that we need to make, but I just wanted you to be aware of them. If you're looking through the reprint, on page 4, the Senate adds 3 members to the Stakeholder Council. It's a representative of the rare disease community, an oncologist, and a representative of a patient advocacy organization. On page 6, the Senate added several reporting requirements. And then on page 8, the Senate requires the board to consider the impact of setting an upper payment limit on patients with rare diseases.
Oh, go ahead.
Oh, no, go ahead.
So these amendments were all discussed. I was a part of the discussion with members of the board itself and the senator and her folks. It was really just a way to fine tune the bill in a way that made it really clear around some of the processes of the board. These amendments really do not change the intent of the bill or the operation of the bill at all. Delegate Kaiser.
And there are 4 more amendments. Sorry, there's a couple more amendments that those were just what the Senate added.
Okay.
I don't know if you want to call on Delegate Kaiser before I go over the rest of the amendment. No. Okay. So
Okay.
the other amendments that we're adding to the Senate bill, and the Senate is going to conform the House bill and add these amendments as well. They provide that a specified report will include specified information to the extent practicable. And they clarify that the prohibition on applying an upper payment limit to a drug, they clarify the prohibition on applying the upper payment limit to drugs in a current shortage. The new amendments clarify that upper payment limits will be set through regulation. And they clarify that specified provisions of law do not apply to purchases and payer reimbursements by federal agencies or federal programs that the state is preempted from regulating by federal law. And that last amendment was there had been a laundry list of federal programs, and there was no way to kind of guarantee we had everything. So this is more of a catch-all.
Right. And so, Lisa, those are amendments we have to adopt, right?
Those are amendments we have to adopt.
Yes. Thank you very much for keeping me on track here. Delegate Kaiser.
Thank you, Madam Chair, and thank you, Lisa, for the explanation. In terms of the Senate amendments, and I was taking notes here, the third one that you mentioned, the impact on rare diseases, I just want to understand, I know that there was a lot of concern expressed at the hearing that it would be not a good idea because of those with rare diseases. So this amendment was put in here to ensure that if we saw a prop that we'd be looking carefully to see if there was a problem, so we'd have a chance to adjust next year or the year thereafter with legislation to pull them out for any reason? Is that the rationale?
That's absolutely the rationale. It was a response to the concerns that were raised, but so it puts an extra burden on the board to be extra diligent around drugs that are for rare diseases. So thanks for clarifying that.
Well, mostly just asking. Thank you, Madam
Yeah.
Chair. Appreciate it.
Any other questions, concerns? If not, please, can I have an amendment, a motion on the
Move.
amendment?
Move the amendments.
Second.
Been moved and seconded. Any discussion on the amendments to the Senate bill? Seeing none, those in favor, please say aye.
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 Anyone, and thank you for raising your hands. Anyone opposed to the amendments? No opposition to the amendments. Can I have a motion
Move the
on
bill
the
as
bill?
amended.
Second.
Okay. Motion and second. The bill's been moved and seconded. Any discussion on the bill as amended? Seeing none, those supporting a favorable motion, please say aye and raise your hands. Okay. Anyone in opposition to the bill as amended? Okay, so I have Delegate Shalega, Morgan. Okay.
You missed somebody.
Did I? I see
I believe I saw Delegate Bandari's hand up. Maybe I'm wrong.
Delegate Bandari, are you in opposition to the bills
No,
amended?
no.
Okay. It was a late hand, Delegate Kaiser, I think. Okay, the bill passes. Thank you all very much. We're holding Senate Bill 376. We'll go to Senate Bill 474, and there are some amendments on this that we just want to make sure everyone's clear on what the amendments that the Senate did. Lisa, want to talk about those?
So this is what we did actually. So we're going to conform. I know it's all complicated by this time of year. So we are conforming the Senate bill to the House bill. And in doing so, we are requiring denial and grievance notices to include certain information at the top of the notice and prominent in bold print, requiring private review agents to make available a phone number and email address dedicated to utilization review that will be responded to within 2 business days, and requiring that specified information be reported by zip code. The new amendments that are in your packet, and these are also being adopted on the Senate side. The new amendments require private review agents to post specific criteria and standards to be used in utilization review on the members and providers pages of its website. Clarified that the requirement to respond to voicemails or emails within 2 business days only applies if a shorter time period is not otherwise required, and alters the effective date for certain provisions of the bill.
Okay. So quickly, the alteration in the date was a response to the fact that we needed to have the private review agent process done more quickly, because otherwise that whole utilization review process would be delayed. So that's why we needed to change that time. We wanted to make sure that we added the zip code information, because we want to look at regional impacts of denials and adverse decisions. There was also a question about there's current law that says that if it's an emergency situation, there has to be a response within 24 hours. And we wanted to make sure that the time regulations in this bill did not conflict with that. So those are the explanations for these amendments. Any questions or concerns on the amendments? Seeing none, can I have a
Move
motion
the amendments.
on the amendment? I've got a
Second.
motion and a
Second.
second. Any discussion, concerns on the amendments? Seeing none, those in favor of the amendments, please say aye and raise your hands.
Aye.
Is there any opposition to the amendments? Seeing none, the amendments are unanimous. Can I have
Move
a
the bill
motion
as
on the
amended.
bill as amended? I've got a motion and a second.
Second.
Those in any discussion or concerns on the bills amended? Seeing none, those in favor of the bill as amended, please raise your hands and say aye.
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 Okay, anyone opposed to the bill as amended? Delegate Taveras, want to make sure your hand is just late. You have a question?
No, it's
Okay.
It's just late.
Okay. All right, that bill passes unanimously. Thank you all. That's a really important bill for this session, so I'm glad that we fine-tuned it. We have two bills that were not cross-filed, and that we heard yesterday. Senate Bill 547. Lisa, tell us what the bill does.
This bill establishes the commission to study health insurance pooling, to study pooling public employee health insurance purchasing among the state, counties, municipal corporations, and local boards of education. There are no amendments.
Okay, is there anyone here to speak on this bill? Just to be clear, it's a study. There is already the possibility of pooling, and has been around for about 20 years, but there's no one has taken advantage of it. This study, I think, is going to enlighten us in terms of how we might use this opportunity to evaluate how to build our insurance pools. So if there are no questions or concerns, do I have a motion on the bill?
Move the bill favorably.
Second.
Move in second. Any, Delegate Salega.
Thank you. What's the fiscal note?
Lisa, do you have that in front of you?
DBM said it can do it with existing resources.
Thank you.
I think DBM wants to do it. There's an opportunity here to save some significant dollars.
Can they not do it without a bill? Do they need a bill to do it? Could they do it with a letter?
Lisa,
I mean,
If
this
it's-
sets up quite an extensive commission. Usually,
Yeah.
where we write a letter, it's more of an informal
Okay,
situation.
thank you.
yeah. So I've got a motion and a second on the bill. Any further discussion on the bill? Seeing none, those in favor of the bill, please say aye. Raise your hands.
Aye.
Aye. Any opposition to the bill? Seeing none, bill is unanimous. Thank you. And the last bill is Senate Bill 956, Health Insurance Medicare Supplement Policies, Insurance Producer Commission. Lisa, what's it do?
The bill requires a carrier to pay the same commission rates to an insurance producer for the sale of a Medicare supplement policy without regard to whether the policy is sold during an open enrollment period as an underwritten policy or within 30 days following the individual's birthday. There are no amendments.
Okay. And in the hearing yesterday, we learned that we did a really good thing when we made the birthday bill, but it did have an effect on brokers. So this bill is sort of to address that effect and level the playing field for these kinds of policies. Is there anyone here to speak or wants to speak on this bill? I have Brad Mainster. Brad, why don't you go ahead?
Yes, is my audio on?
Yes, it is.
Basically, I'm available for questions as a 30-plus year veteran of the insurance industry. If there are no questions, I don't need to take anyone else's time otherwise.
Well, thank you very much for being here because I actually anticipated questions. But if the committee feels comfortable, I see no hands raised. So I think we're good. But thank you again, Mr. Mainster.
You're welcome.
Can I have a motion on the bill, please? Is there a motion on the bill?
Move favorable. Second.
Okay, we have a motion on the bill and a second. Any discussion on the bill? Seeing none, those in favor of the bill, please say aye. Raise your hands. Okay. Those opposed, anyone opposed to the bill, please raise your hands. Seeing none, the bill is unanimous. Thank you all very much. Unfortunately, this isn't our last meeting for this session. Please, again, stay tuned to your emails and messages on the floor and have a great weekend. We are voting at 1:30 today, so we'll see you.
I thought it was changed.
It
It was
do you know?
changed. It was changed to 12:15, I believe.
Well,
Yes.
thank you.
Is that what you had, Delegate Kaiser?
Yeah, yes, thank you, Delegate Morgan. I thought
Okay.
Lisa or our Delegate Coulson had announced it at the beginning.
Okay,
No,
cool.
no, I hadn't heard that, but great.
I
Thank you
think we
very much.
got an
So,
email right.
right when I was signing in, probably. Thank you all very much. We'll be voting in 15 minutes. Have a great
All right.
weekend.
Thanks, bye-bye. Voting? Or I thought, oh.